My name is Zainab Shinkafi-Bagudu. I'm a pediatrician. I come from Nigeria. I founded a cancer organization known as the Medicaid Cancer Foundation in Nigeria. I also run a diagnostic center. In addition, I'm the current president-elect of the Union for International Cancer Control. My background in science and mingling, engaging patients has given me the opportunity to be able to see patients from a scientific point, and I try to encompass that in my work as a scientist.
Thank you. And from your perspective, what are the most pressing challenges in cancer care in your region?
Well, cancer, I think there's a presumptiveness in the West and high income countries about the level of awareness and the information that is available regarding cancer. The things that is taken for granted, the internet, information flyers, and so on, we do not have. On top of this is a cultural stigmatization, traditional beliefs, and institutions that do not really promote health-seeking behavior the way we would like it to be, particularly when you look at conditions like cancer. So for me, the biggest barrier that I face is the lack of education and awareness about cancer. Then, of course, we have infrastructural challenges like human resource and the facilities, equipment, hospitals, the system, the entire ecosystem of care for patients is not as we would like it to be. So that's a huge barrier. Affordability and access in terms of distance to care, adequate care, often deters patients from going to a proper hospital. And so they end up going to traditional and religious rulers or religious healers, Another very, should I say, unspoken barrier is the poor usage of the chemotherapy that we have available. So improper prescriptions, dosaging for the radiotherapy as well. So we need better guidelines. We need to have more people that are trained, right from nurses to oncologists, medical physicists, all the entire spectrum of care that is involved in cancer. We need more hands. Recently, we've seen an influx of medical professionals, all professionals actually, from Nigeria and other low middle income countries to the higher income countries, particularly after COVID, searching for greener pastures, searching for better life, and so on. So these things affect us in the long run. And even though, yes, they're going to get more training and more capacity building, it is a loss to the low-income countries. Availability of the medications that we need and other products such as vaccines is not where we would like it to be. Local production, some policies do not favor local production. And so and then with the economic downturn, again post-COVID, there's been an influx of the manufacturers that we have in the country. So these are just a few of the things. But if you ask me on a daily basis, what is my biggest barrier? Honestly, it's awareness. Because I see women who sit at home until their breast is practically a fungal mass, it's fungating, and they do nothing because some don't know. Some will say it's an evil spirit. In my language, cancer is called Chiwon Daji. Daji is the forest, so something thick, unknown, just the forest. And that's what cancer is in my local language. So that really draws us back. I recently found a woman living in my house with Peau d'Orange on her skin. She goes on awareness walks with me. Every year we have a huge awareness walk in Abuja. And she didn't say until it was Peau d'Orange. And she was arguing with me that it was just a month. And I know it wasn't a month.
And how do you think that cancer awareness and also patient education can be improved? And who should take the lead there?
Yeah. I think the civil society, as well as organizations and patient advocates, need to take the lead But there must be full support of institutional structures like the government, like the religious leaders, like the traditional rulers, and other champions that our local people listen to. The government is so busy providing hospitals and building the roads and access and paying salaries, insurance coverage, and so on. So who is going to bridge that gap in between the patient and that high level? You don't expect governments to come and start doing awareness, but there are gatekeepers to each community that the people believe in, that they listen to, that can influence change in them. So if we have agents of change like myself and other activists in the civil society space, then we will see some traction. But for that to happen, government needs to recognize that we exist and then have that partnership. It's a form of partnership that has to be really made part of our health system. It's not just limited to cancer, it's everything, whether it's women giving birth in hospitals, taking immunizations, routine childhood immunizations, it becomes a huge burden and barrier. So awareness is a big thing. And if we're able to get the key actors to really be involved in it, then I think that we can see, magical change in the way we respond to cancer.
Okay, thank you. And to conclude, how can patients or patient organizations become more involved in shaping healthcare policies or research priorities?
Well, patient organizations are very key. Many of them have patients who have lived experience. And so by talking about the experience, by looking at what opportunities are available and bridging it and really amplifying that patient voice, then we can help to change the narration of the course of disease of others. And then patient organizations also need to be more goal-oriented. What do I mean by that? Sometimes it's just a foundation and we're talking, and are you recording how many talks you give? Are you recording how many patients or people you have been able to convince? How many villages did you go for that outreach, and so on and so forth? Data, implementation science, putting a little bit of science into the work, into the advocacy that organizations do. We have many organizations, but they're not so trained in how to run it properly. What are they doing with their books? Where are they getting funding from? They're not, because they don't have data to apply for the grants that need to show that they need to show the work they're doing. So there's a lot that we can do better. And if, as I said, there's a lot that can be achieved through patient organization.